I'm Andrea Levinson. I'm a psychiatrist here at CAMH, and I head the Early Intervention Clinic, which is a clinic that provides assessment and treatment for young people with psychosis and in the context of mood difficulties. There are more and more students who are identifying themselves as having concerns regarding mental illness. I see mental illness and mental health as a continuum on the campus, but certainly more and more students are identifying presenting issues or even coming into the university with prior difficulties in terms of mental illness and presenting with a lot of acuity in terms of symptoms that they're experiencing and quite a lot of complexity. The most common problems that students face are related to academic stress, and they are mainly anxiety and mood difficulties, forms of depression or milder forms of mood dysregulation. And then there are also a number of students who start to manifest symptoms of issues relating to eating disorders, substance use and abuse, and the whole continuum of that regard is a key theme. And then there are students who have illnesses like bipolar disorder, psychotic disorders. There's the whole gamut. The main message for students completing high school and entering post-secondary institutions would be to realize that there will be a transition, that things will feel different, that there will be a whole lot of life transitions in terms of sometimes living on one's own, regulating one's day, structuring one's study and work schedule. And I think connectedness and being connected to family whom you may have left, whether it's chatting, texting, Skyping on an ongoing basis, developing connections in terms of friendships, roommates in residence, knowing that there are people at a more senior level, be it dons in residences, and knowing that there are services at whatever university you're at where you can sit down and chat with someone. My main message to families who have a young one who is a young adult who is starting university would be to remain connected, to develop an expectation of how frequently that connection would be, how it would happen, and if that connection is lost or there's an interruption, that the families would then need to take note and have someone who they could contact and inquire about how their child is doing.